You know, when I first came to Victor Valley College, it was as a student. And then when I returned to Victor Valley College, it was as a volunteer member. When I returned after that, it was with our state assemblyman's office to sit in on advisory panels and check out all of the things going on all of our different campuses. And now, being with the Victor Valley College Foundation, I get to see all of the time the kinds of folks that Victor Valley College is training, educating, and producing for our community. And I am incredibly proud of all of the folks that we produce here at Victor Valley College. But I bet a lot of you didn't realize that we produce as many heroes as we do. Ladies and gentlemen, let's go ahead and welcome one of our departments that I truly consider a hero maker. They're going to be giving their presentation of, so you think you could be a healthcare provider? I know that is definitely a very daring question in today's day and age, but ladies and gentlemen, please help me in welcoming Director of the Nursing Program, Dr. Teresa Cicci, and of course our Nursing Department Chair, Terry Truelove. Welcome, folks. Let's see.
Hello, you all. Nice
Hi
to be
there.
Here. I'll Dr. Cicci get her presentation running.
No problem. No problem. We've all been there, especially this year with Zoom. I don't know if anybody ever has fun with this, walking to see how far away they can get from their virtual screen before they start to disappear.
Okay. Hi, this is Teresa, Dr. Teresa Cicci from nursing.
Hi, Dr. Cicci.
Impaired. I'm getting there. Okay. You can see my face up there. So, okay, what am I doing now? Share.
All right. Ladies and gentlemen, if nothing else during this year, we've definitely learned to roll with the punches. So Dr. Cicci is getting herself all situated, so we'll wait right there. But while we're getting started, it's important to know that our nursing students, of course, we're going to hear about it right now, but our nursing students go out and spread all over, not only California, but all over the country after they leave our very well-developed, very prestigious program in a nursing department. We have lots of community members who love to support our nursing students because obviously they go back out into the community and you see the results of what they're learning here at VVC firsthand right away. And especially in a year like 2020, when we've been in a pandemic and been away from what we're used to, these folks have been out there on the front lines being heroes. So it looks like we're all set. Dr. Cicci, are you all ready?
Yes, I think.
Oh, well, it's my pleasure to turn it over to you.
Thank you. Okay, so Victor Valley is very popular in our communities here. In our healthcare programs. Okay. And so I'm sorry, I'm trying to find out how to go to the next slide when I'm ready. Anyway, could you just go back to the first one? Thank you. I want to introduce Terry Truelove, who is from the department. Terry, where'd you go? Oh, there he is. Okay. So Terry is faculty, our department chair, and our sim lab coordinator. And sim is short for simulation, which means we actually simulate rooms in the hospital, situations in the hospital. It's a very, very big part of healthcare education now. Okay, next slide. Do I have to tell him that? Great, thank you. So I'm going to start out with hierarchy of nursing and healthcare. We have a certified nursing assistant, CNA, which some schools place in the allied health area, and that's how it's placed at Victor Valley. But I like to keep the certified nursing assistant with the nurses because they're very, very, very big helpers of nurses, and it tends to be a required course for some of the other nursing healthcare classes. You'll find these certified nursing assistants in hospitals, many, many in skilled nursing facilities, home health care, This skilled nursing is the basic course that everyone has to take. You can go on to get the home health care and the acute. Sometimes we see them in doctors' offices and clinics. This is often a prerequisite course for the licensed vocational nurse or the licensed practical nurse. California and Texas are the only states that call it an LVN. All 48 other states call it an LPN, licensed practical nurse. They're the same thing, same training. This is a patient caregiver like a CNA, but they're trained for 3 semesters and they can give medications and do dressing changes, the things that CNAs can't do. But they cannot do a lot of the things that registered nurses can do. The registered nurse, okay, is a basic RN, but that's where kind of the top of the pyramid begins. So registered nurses actually supervise CNAs and LVN, LPNs. They do patient care, but they can do facility management. They can do education in a facility or in higher education. So you'll see them in hospitals, skilled nursing facilities, because the LVN, LPNs have to have RNs there to work under. There'll also be home care, hospice, which is a program now for people who want to die in peace and at home. You'll find your RNs on the IV teams that start IVs for people in the hospital, emergency room, the ICUs, the PACU, which is post-anesthesia care unit, which formerly was called the recovery room. RNs do a lot of research, especially in big academic hospitals and universities. And here's the fun ones. They work on cruise ships, amusement parks, airports, in the schools. So we need nurse practitioners and, registered nurses, because people get sick or get hurt, fall and skin the knee, or in cruise ships, they might have really bad, travel illness and whatever. Industry and corporations, we see them a lot now. As people age, they have a clinic if someone has chest pain, or maybe in this last year, they think they have COVID. Same thing with airports. Nurse practitioners have a master's degree, nurse anesthetists, work with anesthesiology with doctors in the operating room, school nurses, the list goes on. You will find nurses almost everywhere. Okay, next, thank you. Okay.
Is there a question?
Question?
No, I think that was just a still. Never mind.
Okay. So in the state of California, there is a 387,000 nursing shortage, and we are the highest paid nurses in the country, but we also have the highest shortage. So if you're even thinking about maybe, it's a really good time to get into nursing. If you're not sure, taking a CNA course might be the way to go to kind of give you an idea, how you'll do there. There are shortages in 50 states. You can go anywhere in the United States and globally and get jobs. The nursing shortage, I'll talk about the length of the programs in the next slide. The CNA shortage, they have more vacancies than RNs. They are the highest paid in the US as well, because they're trying to attract people. 44,500 short in some places. Florida, 53,700 surplus. So you have to be careful with CNA which state. Okay. Okay. At Victor Valley, we have an ADN program, which is an associate degree in registered nursing. And we are in process soon in the next couple of weeks to have a bridge to the Bachelor of Science in Nursing. This is what you get in a 4-year program. In the associate degree programs in the community colleges, the 4-year schools now have began to accommodate the associate degrees. So it's all online. You can get some of the courses while you're in the ADN program, or you can wait till you get out. But they've made it very, very easy to get a Bachelor of Science now. You have to be a high school grad or have a GED to get into any registered nursing program. The BRN, which is the Board of Registered Nursing, every state has one, requires around 20 units prereqs. For the associate degree at any community college, you've got units that you have to get, and some of them cross over to actually get the associate degree. Prerequisites for if you want to go on for that BSN are 7 units. One is the statistics course. It's a undergraduate degree level, and also political science course, which you can actually take up here and already have it. We have a pre-nursing course. So when you're done here, you can apply to the program. But we have pre-nursing for 6 units, and that is once you're accepted, you can come into this part of the program and take pharmacology for nursing and assessment, physical assessment for nursing. And then you'll move right into, once you pass these 2, you'll move right into the program, 4 semesters, spring and fall semesters. You must maintain through the program a 75% or better or a C or better. The BSN program, some of them you can take 2 free units. That's their kind of come on in. And then you take those while you're in the ADN program. And then there are 21 units when you're done. You can finish this program if you do your 2 here in 1 year. So basically you can get done with the BSN before the 4-year programs do. Next slide, please. Okay, once your prereqs are completed, like I said, then you'd apply to the program. So we look at, of course, the application, but your high school and your prerequisite GPAs. We want to see that you've got that 2.0, but remember, you'll be competing with people with 3.0s and 4.0s. So you want to make sure that you're really, up in the ante. Any previous work in healthcare gives you extra points. It's a point system. Essay and interview, you will be have to do fingerprints, get FBI background check. And here's just some of the things that you'll need. A negative TB test. If it is positive, then we have a way of getting you through that. Flu shots, the places we work require flu shots. If you have a problem, you've had reactions before, there is a form you can sign that you're willing to opt out and still go to clinical. Now we're looking probably at a COVID vaccine sometime in the future. You have to get a physical every year, your vaccine titers. So we're working with people who are ill, and we don't want to go in and give them another illness either. So we're being checked basically sometimes like patients are. Next, please. Okay, so that's the nursing, the ADN nursing. The CNA course, you don't have to be a high school graduate. You can get in at 16 years or older. It's 1 semester of study. And then when you're done, we bring some of the state teachers, instructors for the California Department of Public Health that regulates this. And they come down and you have a written and a clinical test out to get certified. In the state of California, if you're not certified, there's very few places you can work as a CNA. Also, that's healthcare work. And so you can get extra points if you want to apply for the ADN program. Plus you get paid once you're a CNA. That's always a plus, okay? Especially if you're in high school, right? You learn basic care. And if you're working as a CNA, that care not only gets you points, but it gives you confidence and some leadership abilities that we're looking at. As you've worked in healthcare, you've got, more comfortable talking to patients, doing care, knowing how to manage your time. Next, thank you. We have a medical assistant program. We've always had it at Victor Valley High School. It moved over to the campus in January. It is 2 semesters. You can start in high school. Victor Valley still has their high school program, but their higher education program is here now. You'll have class and skills lab in the first semester, and then you go to the second semester to use some of those skills in clinical practice, just like the nurses and the CNAs do. We're also bringing in a phlebotomy program in June. It's a community program now, but it will become part of Victor Valley. You can start this, or high schools have it, or come to college and get credits for it. Again, if you're working as a phlebotomist, it's counted as healthcare practice if you decide to go into the ADN program. And again, you have a whole semester of class, and then your clinical practice is the second semester, and you have complete control over that. You will be given the directions to contact the places that we have as clinical practice, and then you'll work with the lab people will come out with you and phlebotomists. So, you know, helping you learn the best ways to gain blood work that's needed for lab tests and stuff that the doctor orders. Next slide. Great. These are, this over here, okay. Just a few little cartoons, you know. We get kind of ribbed a lot about how many times we wash our hands in a 12-hour shift, and we do it a lot, and we do it for at least 20 seconds each time, and we use a lot of the hand sanitizer, and you've pretty much found that out since we have now been experiencing COVID for so long, that washing your hands is extremely important to get rid of bacteria, viruses, fungus, those kind of things. So we don't want to give patients more infections, and we don't want to take any home with us, okay? You might all be familiar with Dr. Fauci, right? Nurse Ratched was from One Flew Over the Cuckoo's Nest with Jack Nicklaus. Great movie. If you know who Jack Nicklaus is, I know some of you are very young, and he hasn't made, he's still making movies. Yeah. Next picture, please. So now a story. So Terry, our faculty department chair and sim coordinator who's with us, wants to talk to you about his experiences of getting into nursing school. You can leave it here till Terry's done.
Thank you, Doctor. You know, I was going to talk about that, and my story is very typical for a success story with a community college. Although it's very easy for me to learn things. I was brought up very poor. We were brought up in Los Angeles, and I could not afford university. So community college was my way out. And I took advantage of that, and I was able to parlay that into the community, from the community college system to a 4-year program to get my postgraduate degree. And here I am, teaching for more than 20 years at Victor Valley College. And the other thing I was going to talk about was the fact and how many different types of learners do so well in our program. And the proof is online. Look up our pass rates at the Board of Registered Nursing website, and you will see that we are the highest in the state, among the highest in the state. And so I was actually going to talk about that for a while, but the premise of this is, do you have what it takes to be a healthcare worker? And I want to talk about that in the face of what we're going through, this pandemic, and to remind all of you who may be interested in a job in healthcare that this isn't the last of these pandemics. To be personally honest with you, I'm surprised it took us so long, something like this to happen this badly. And I also am very grateful that it wasn't worse. So I want to ask you to ask yourselves, do you have what it takes to be there for your community, to sacrifice your time with your family, your safety, and not only from pathogens? Nurses are the most abused profession. And it's not just the registered nurse, it's the nurse's aide. And so it's a dangerous profession. You have to sacrifice your own well-being, your own emotional well-being, your own physical well-being, your own psychic well-being for the benefit of your community. And it's a really, really large thing to ask. And by the way, it's not just the nurses. It's our respiratory therapists, our phlebotomists, our medical assistants, and our physicians. But to be frank, of all of those professions, the physician sees the patient less, and the nurses and the nurses' aide sees the patients the most. And during a time like this, when we're all isolated, I want you to think about this. How many times a registered nurse over the last year has been the only person in a patient's room as they were dying of COVID-19. And the only contact they had was on an electric device, one of these phones that don't come through here. And that's the only way they were able to communicate with their loved ones, was through FaceTime, like this Zoom. Do you have what it takes to take care of your community? Do you have what it takes to really be out there and put yourself out there for the sake of your community? And so when something potentially dangerous like a vaccination comes around, are you first in line? Are you out there getting that, knowing that you could be sacrificing an awful lot, but the rewards on a personal level and the rewards on a community level simply can't be touched. So I'm not going to give you a presentation about do you have what it takes to be a healthcare worker, particularly now. It rings hollow, but what rings true, but what is a powerful truth is when you ask yourself that very same question, when you look in the mirror, and if you say to yourself, you know what, I do have what it takes. This is something that I want to do. And yeah, maybe the money's pretty good, but it's not worth it, man. It really is not worth it. It's what you gain here and what you gain up here. And if you do it the right way, and if you're in it for the right reasons, I can't think of any other thing that I'd rather have behind my name than registered nurse. It's the first two initials that I put behind my name. I kind of identify myself. When someone says, what are you? Are you? What do you think like? I think in my head, well, I think like a registered nurse. If you think you have what it takes, we need you. You know that. Come on board. We need medical assistants. We need nursing assistants. We need respiratory therapists. We need registered nurses. We need vocational nurses. We need your help. So I hope you have it in you. And as dark as that was and as kind of uplifting as this was, I wanted to be truthful. I wanted to be real. And if I see you on campus, I'll welcome you. And at this time, I'll say I'm done. Thank you all for listening. I guess I have to ask if there's any questions.
Thank you so much. I mean, I think I can speak from all of us that we are so grateful for all of our healthcare workers and all of the care and the sacrifice that you provide to all of us. So thank you so much for that. Yeah, any questions, students? I'm Amy Asol, by the way, just popping in, filling in for Chris right now. Any questions, students, from our award-winning or to our award-winning faculty in our award-winning nursing program? Any questions out there? I think I can ask a question. I'm going to follow Chris's footsteps in the meantime. So he's been asking all of our panelists, what was your first job? And I'll start with you, Terry. What was your first job where taxes were taken out, you know, when you started working?
Well, the first job I got when taxes were taken out was for an old lumber store called Ole's. Oh, kind of like a Home Depot. And I worked in the lumber department and I knew zero about wood. Hey, I was 16, it paid.
Absolutely. Doctor, what was your first job where taxes were taken out?
Oh, I was 17 in the summer at the Tasty Freeze. It was fun. I'm surprised I didn't gain about 50 pounds, but yeah, I was at the Tasty Freeze.
All right, nice. All right, so let's see.
What sparked your interest in nursing?
Mine?
Both of you.
Okay, I never thought about being a nurse all through high school, and I went to college for 2 years to be a special ed teacher. So I guess I'm pretty close, huh? And I was in college and I was taking a bunch of science courses and loved it, and math, and someone was in pre-med and said, oh, you love healthcare then. And so I left college because I didn't have a nursing program. And I graduated from a 3-year nursing program in Baltimore, Maryland in 1977. So it's been about 43, 44 years, and I've never, not for 1 second, regretted it. I love nursing. I love the patients. I love the students. Oh, I guess I love the faculty. No, I have really, really wonderful faculty here. I am blessed, and my staff as well. Okay, Terry, you're on.
I have a roundabout. I'm an accidental registered nurse as well. Originally, I was making a living as a musician. However, my very wise father said there was about 10,000 other rock bands in Los Angeles. I might want to do something. And so I decided to take advantage of community college system. Got a degree as a respiratory therapist. During that, though, I decided also that I wanted to try working as a marine mammal trainer, and I got that job. And that ended me up in Seattle, Washington. So it doesn't pay, though. So I had to still work as a respiratory therapist. And while I was at Seattle working as a respiratory therapist, I worked for the University of Washington Harborview Medical Center. And I watched what the registered nurses were doing for the first time. And I thought, I want to do that. So I went to school, Seattle Central College, got my degree, and here I am 31 years later. And like doctor, I do not have a single regret. I'm so glad I went to school for a registered nurse.
And by the way, we do have a respiratory therapy program here at Victor Valley. They are not a part of nursing and allied health. They're kind of their own department. It's a very active program. Most of the clinicals are done down at Loma Linda. Classes are up here. So if you're thinking, maybe, okay, you might want to look into that as well. Yeah, but nurses at the bed 24/7.
Right.
12-hour shifts, 3 days a week. Go ahead, Amy. Sorry.
No problem. We have a few questions in the Q&A section. So how do you handle the stress of the job is one question.
I play guitar. I take a lot of walks. Actually, it's a very big question because many nurses burn out. I will tell you that I don't do bedside. I have not done bedside for a number of years now. And it's specifically because the stress simply became too much for me to handle. I was already a professor of nursing, and I just decided to finish my last 5 or 6 years as a registered nurse with the college, which I'm wrapping up now. It's very difficult. And for some of people, and I'm one who would say this, I have a limited lifespan as a nurse. I gave all of myself when I was at the bedside. And although it seems like it might be infinite, at least for me, and I think for a lot of my colleagues who are walking away from the bedside, it does become to the point where you just simply don't have much more to give. So there's a lot to give. I did it for 20 something years, but yeah, after a while you have to protect yourself and go, okay, I can't give any more of myself, and it's better that I walk away.
I think that what we're really seeing in nursing now is teaching nurses how to take care of the caregiver.
Mm-hmm.
You can't take care of yourself. How do you take care of other people? And if we didn't have nurses going back to school and getting a master's, we wouldn't have educators or managers in the hospital and in education and those things. But certainly we have to have nurses at the bedside. It is very rewarding because you are a part of a team, and every day when they make patient rounds, you are the leader of the team with the doctors, the pharmacists. So we have a very interprofessional approach now that we did not have in the past. And so you learn to get very comfortable with those people. So when you need something, they trust you, they know you, they trust your opinion, your perception. So it's a good relationship in most places. We still have some old school doctors, but for the most part, they're starting to watch these, younger doctors come out of medical school and trying a little bit now and then to do some of that. So it is a great profession.
You sparked something in me that reminds me that when I started, patients didn't have self-determination. Basically, the medical profession told the patients what to do. And of course that changed. But I worked early in my career with nurses who basically were there when CPR was invented. And they told me in those days how they were working with people who were around when penicillin and other antibiotics were invented. So this is a cycle, and from what you'll learn from me, you'll be new here, and then in 20 years, you'll be teaching about nanotechnology and new mRNA sequences to your brand new registered nurses in the year 2040.
Another question, did you say that this is coming from a student, did you say that, Christina Mora, did you say that the nursing program at VVC is ranked high ratings in the nation? What is the salary of a CNA nurse?
Well, the CNA I did not speak of. I was speaking of the registered nursing program.
Mm-hmm.
So CNA is certified nursing assistant. RN is registered nurse. Terry, do you want to speak to the rest of that question now?
Yeah, the success rate is determined in any nursing program throughout the country. And what is the percentage of students who passed what's called the NCLEX examination on the very first try? And the NCLEX examination is a nationally standardized, but a test that is given by the states to pre-licensed nurses. So just because you get through a registered nursing program doesn't mean you can work at the bedside. You have to go and sit down for this examination, this comprehensive examination called the NCLEX. And if you don't pass it, it doesn't matter how much school you have, whether you have a master's degree or a bachelor's or an associate's degree, you're not working as a bedside nurse. So Victor Valley College since 2015 has had one of the very best pass rates in the state and is nationally ranked in the United States as one of the best schools for first-time pass rate. And I want to remind you, that is the benchmark that programs use to judge their quality.
It is also the benchmark that is used by the Board of Nursing in every state that issues the licenses and is involved in the NCLEX or the licensure exam.
Great job, fantastic. So thank you so much for sharing. Thank you for being here.
Thank you for giving us the time.
Yes.
Thank you very much for giving us the time.
Yes, absolutely.